Hi everyone, this is Deepa from the Living Proof Institute, and today we are going to discuss a case study on PCOS, which is Polycystic Ovarian Syndrome, fatigue, and obesity. Before we begin, just a short disclaimer, this case study is not intended to treat or diagnose. This information is provided by the Living Proof Institute and is not intended to replace the medical advice of your doctor or healthcare provider. Please consult your healthcare provider for advice about a specific medical condition. Tammy presented to our office. She's a 34-year-old female. She's a mother of 3 children, so she's very busy and she requires, full energy to be able to take care of her children. She is a stay-at-home mom, so this is her primary job. She's overweight, she's tired, and she's unable to play with her children. Her fatigue has significantly worsened over the past year, and she wants to have more energy to be able to provide for her family. She also has hormonal issues, and she has issues with her digestion, which we'll discuss more in the next slide. So her clinical presentation, so she has polycystic ovarian syndrome, and some of the symptoms of this are she has acne, she has facial hair, and she has thinning hair on her scalp. She also has an irregular cycle, so when she does have a cycle, she has lots of PMS symptoms, and she's bedridden because she's just so depleted from her cycle. It's very heavy, and she has a lot of mood issues and ups and downs with her cycle as well. She has low energy, and she feels tired all the time. She has weight issues, and she has a very hard time losing weight. She also experiences constipation, bloating, and abdominal pain, and she has a history of depression and anxiety. Her 3 main goals are to fix her hormonal problems, specifically her PCOS and irregular periods. She would like to improve her body composition, and she would obviously like to improve her energy. In terms of previous treatments that have been rendered, she had seen a nutritionist in the past to address these issues, and she was also on a long list of supplements prior to coming in to see us. So one of the key things that I identified with her during our consult was that no one really talked to her much about sleep. She did see a nutritionist in the past which had advised some dietary strategies, but no one spoke to her about sleep, about stress management, about exercise. None of these aspects were really discussed with her, and this is really the foundation of our program, is to ensure that all the basics are being covered before we even do some of the functional lab testing. In terms of some of her main complaints, the low energy, bloating, and difficulty losing weight, definitely wanted to run an organic acid panel on her just to see where she's at in terms of these issues, and we'll go into the testing in a little bit more detail to see how it helps identify if the patient is having any issues with these areas. In terms of the polycystic ovarian syndrome and the irregular periods, I definitely wanted to run a Dutch test on her, which is a hormonal test. It looks at female sex hormones, and it also looks at adrenal hormones. So definitely wanted to assess those hormones to see where she's at in terms of testosterone, estrogen, progesterone, cortisol, all the hormones that are relevant for PCOS and for irregular periods, and also for low energy. So we'll go into these in a little bit more detail in the next few slides. And then we also ran a stool test on her, which I'm not going to really talk too much about in this case study here, because the 2 main tests that we actually focused on in the first few months of her care were the organic acid test and the Dutch test. So definitely want to go into more detail on those 2 tests. So in terms of our functional lab testing, this here is basically just summarizing her hormones from the tests. And what we can see here is that when we look at the adrenal hormones, we see that the total DHEA production is quite high. And usually when DHEA is quite high, it identifies that the patient has some kind of inflammation going on. We also see here that her 24-hour free cortisol, which only represents about 1 to 3% of the active cortisol, is elevated. And then we also see that her total cortisol production is elevated as well. And this definitely can explain a lot of the symptoms that she's having, particularly the low energy, particularly the insulin resistance, the PCOS. These are all issues that can kind of be tied in with high cortisol. So, that's one of the main findings that we had found on her Dutch test. When we look a little bit deeper at the sex hormones here, we see that her progesterone is quite low, and that's indicated here by this first box. And that low progesterone is almost in the menopausal range. And she is obviously premenopausal, being 34 years of age. And low progesterone can lead to symptoms of difficulty falling asleep, mood issues. So these are all issues, that are associated with low progesterone. When we look at her testosterone, we look at the metabolites of the testosterone, and we see that her androsterone, which is one of the testosterone metabolites, is elevated here. And when we see an elevation in the androsterone, that basically is a very potent androgen. It's 3 times more potent than testosterone, and this definitely indicates her issues with PCOS. So we definitely want to focus on addressing this issue right here. We also see that her estrogens are quite low. So there's 3 estrogens that are produced, and in a premenopausal female, estradiol is one of the main estrogens that's produced, and it's almost in the menopausal range here. So that's definitely something that we're going to want to address, and it can also explain her irregular periods. In terms of her organic acid test, here are some of the findings. We see that she doesn't metabolize fats very well. So when we see an elevation in these 2 markers here, it basically lets us know that she's not able to utilize her fats as an energy source. And this can be an explanation for her difficulty to lose weight, especially since she's eating meat and she's not vegetarian. We shouldn't really see these markers elevated here. We also see the beta-hydroxybutyrate elevated, and this is a definite marker of insulin resistance, which is a huge piece in polycystic ovarian syndrome. We definitely want to focus on insulin resistance. So that also is a huge finding in her case. And then when we look at her energy production markers, the mitochondria is the powerhouse of the cell. It basically produces your ATP, which is your currency of energy that is used by the human body. And what we see here is that her energy production markers are all elevated, which is obviously going to impair her energy production, and therefore she's going to feel tired. So this is a huge finding in terms of her low energy, and something that we will really want to focus on. One of the other main findings with her test was that her organic acid test was this section here, which looks at bacterial overgrowth, specifically in the small intestine. And we see a lot of elevations here, and a lot of markers that are approaching the red here. And this basically indicates an overgrowth of bacteria in the small intestine. So it basically is an indirect of measuring something called SIBO, which is small intestinal bacterial overgrowth. And one of the main symptoms of small intestinal bacterial overgrowth can be bloating, which is one of her main complaints. Constipation can also be a main symptom of small intestinal bacterial overgrowth, so definitely something that we're going to want to work on and address. So in terms of clinical and lifestyle protocol for Tammy, from the Dutch test we saw that her estrogen was very low, so some of the lifestyle recommendations we gave her were to avoid gluten. Gluten can stop periods, and she has irregular periods. We also advised her to add flax seeds to her diet. Flax seeds are phytoestrogenic, and in her case it would be very beneficial for her to include those in her diet to increase estrogen. We also gave her a recommendation for the high testosterone. We want her to increase her fiber. We definitely want her to eat a low glycemic diet, so definitely want her to avoid sugar. because we don't want her to produce insulin as much because she is insulin resistant, and this is one of the key findings with polycystic ovarian syndrome. We also want her to eat foods high in zinc, which can help lower testosterone, and then we want her to avoid dairy, and we want her to include some form of yoga in her day-to-day routine, which can help with high testosterone as well. As we saw in the Dutch test, we saw that her cortisol was very high, so we definitely want to focus on lifestyle aspects for cortisol. You can't really out-supplement stress. There's definitely supplements that we can give to help her adapt to high cortisol and help her body handle the impacts of high cortisol. But in terms of the reason why the cortisol is high, which is usually some form of stress, we definitely want her to take control of stress in her life and incorporate some kind of deep breathing, meditation, or yoga practice. In terms of her low energy, we definitely want to address her irregular sleep and wake time, so I advise her to stick to a regular sleep and wake time. And then we also want her to avoid blue light to help improve her circadian rhythm and help her getting sleeping better. And then we also gave her some supplement support to help the mitochondria produce energy more efficiently. So in terms of outcomes, after a 30-day follow-up, after giving those initial recommendations, she had lost 5 pounds, which, she hasn't lost weight in a very long time because she was so resistant to weight loss. Her energy had substantially increased. She was able to play with her children more. She felt more energetic in the morning and throughout the day. She was having a daily bowel movement, which was a huge progress for her. She was going to the bathroom every 3 to 4 days, so having a daily bowel movement was definitely a huge improvement for her. Her mood improved. She had a period. She hadn't had a period since January, and so she had a period, and it wasn't as heavy. So, in Tammy's case, we saw a lot of positive improvements with lifestyle recommendations, and then also we found a lot of hidden blind spots with her testing. So, in order to feel your best, and if you want similar results to Tammy, we recommend that you join our Facebook group. So we have a Facebook group. The link is lpicommunity.com, and we'd love for you to join our Facebook group. We share lots of cool information in that group. We would also recommend that you register for our free 30-day program, which is 30in30.org. And then if you're ready to become a living proof patient, you're welcome to schedule a 20-minute free phone consultation at www.improof.com, and we'd be happy to discuss your case, and we'd be happy to let you know more about our clinic. So I hope you guys enjoyed that presentation, and have a great day. Bye.